Moving on now to our next story. It's another example of government gone wild. The Obama administration has doled out almost $4 billion over the past 6 months or so. That is more than $22 million a day. Why so fast? Some say this smells an awful lot like the White House spending while it can in case the Supreme Court overturns the health care law this week. We turn now to Senator John Barrasso, Republican from Wyoming. He's also a surgeon, and we get his take. Thank you so much for being here, Senator.
Thank you, Melissa. Thanks for having me.
What do you think is behind this speedy spending?
Well, I think you're absolutely right. So far this year, the administration has been putting lots of money out as part of the health care law. And over the last 3 months, just since the Supreme Court oral arguments, they've really stepped on the gas. The administration has and spent twice as much in the last 3 months as they did in the first 3 months of this year. I think they're very worried that the Supreme Court may find the law unconstitutional. We'll find out Thursday, but they're trying to get money out in a way that I think is very irresponsible. I wanted, and I co-sponsored legislation to stop all the spending on implementing the health care law. I co-sponsored this about a year ago to say, look, until the Supreme Court decides, quit spending taxpayer dollars on something that may be unconstitutional.
And they would say that this money has been allocated, so it's all fair and square. In a recent Wall Street Journal article, Dr. Stephen Greer, though, says that his group was told, and they're part of the vetting process for the Center for Medicare and Medicaid Innovation, they were told to assemble a team and grade find 12 grants to award out of 3,000. They had 2 weeks to do it, to go through 3,000 grants and pick people. There it is right there, the part of the article. They said this is something that they would normally have months to do, but they were told, you've got 2 weeks, get it done. We want to get this money out the door. So people are out there sort of seeing the rush. I guess my question is, if the law is overturned on Thursday, will we get this money back as taxpayers?
I don't see how we do get it back, but it's another example of wasteful Washington spending, making these quick decisions, getting money out the door. And the other thing that they've been doing, Melissa, is they've been spending taxpayer dollars on publicity on a PR firm, another $20 million that went out for a private PR firm to publicize the health care law. I view it as taxpayer dollars going for propaganda. This health care law continues to be very unpopular. The administration is paying with our taxpayer dollars to try to convince the American people that it's better than it is, but the American people have seen through this. We know that this health care law is bad for patients, it's bad for the nurses and doctors who take care of those patients, and it's terrible for taxpayers, and that's why 72% of Americans want the Supreme Court to overturn this health care law and
Senator,
say that it
let
is
me ask you about the $20 million, because I thought that was an interesting point that they spent on this health care public relations campaign. We've heard about this before. What was the goal of the campaign, and what cost $20 million?
Well, they took money from a section of the law having to do with prevention and are using it instead for propaganda to just try to talk about what they perceive as benefits of the health care law only in terms of educating the public, not in terms of how to prevent disease. And I'm a doctor, I focus on preventing disease, but they want to use the money and are using the money, and their contract calls for using the money to actually promote the law rather than to promote prevention of disease. So this is all being done. There's a lot of political games being played by the administration, and as you said, they're spending more and more, so much every day until the Supreme Court rules, because they're worried that they may find that this health care law is unconstitutional.
And we're worried about the speed at which this money is flying out the door, because we understand, according to the GAO, that $48 billion are stolen from taxpayers through Medicare and Medicaid fraud every year already. So it's a number that it's sort of ripe for fraud already. So if you go through the process even more quickly than usual, do you think that it's more likely, our dollars are going towards fraud and aren't being used to good use?
Well, we talk about all the problems with waste and fraud and abuse. You sure worry about the fraud here, but clearly waste and abuse as they rush this money out the door. And this is money, that the hardworking taxpayers all across the country sent to government. But I think this is why, Melissa, so many Americans just don't believe that they're getting value for their taxpayer dollars, and why people are up in arms, and why so many believe that the country is heading in the wrong direction under President Obama.
I also worry about the people involved in this. I mean, Secretary Sebelius awarded $128 billion to 219 health centers. It created jobs for more than 5,600 doctors, nurses, dental providers, support staff, all new jobs. What's going to happen to those people if the law is overturned? Are they immediately out of work?
Well, this is one of the big concerns of the health care law. Nancy Pelosi said if you passed it, there would be 4 million new jobs. She said 400,000 almost immediately. But what the Congressional Budget Office looked at this said, no, over time, actually, this is going to cost jobs, up to 800,000 jobs. And we have 8.2% unemployment in this country, so many people out of work. I mean, what you're describing almost sounds like kind of the failed stimulus program. Put out some money, hire some people temporarily, and then the money gets
But
goes
Senator,
away,
is it temporary? That was my
work.
question. You know, is it temporary? These people that were hired on this money, you know, that was connected to the health care plan, if health care is overturned, those people that were hired, do we get that money back? Are they right out of work? Do you know about the logistics?
No, I think that even the Secretary of Health and Human Services doesn't know about the logistics.
Yeah,
All they seem to be focused on is getting the money out the door before the Supreme Court rules on Thursday.
Senator, we appreciate your time. Thank you for joining us this evening.
Thanks for having me, Melissa. Thank you.